everyone. We are live today with Dr. Mameniskis.
Hey,
hello, Dr. Mameniskis. So guys, I told you that we would have a very special surprise. And like I said, today we have Dr. Mameniskis here. So any questions that you guys may have, please feel free to ask Dr. Mameniskis. So, Doctor, let's start off strong. What procedure have you done this morning?
Procedure I've done a BBL, and we're just going to ready to start a BBL and a tummy tuck.
Awesome. So guys, if you didn't know, this is the greatest of all time in terms of BBLs. And he also does the highest BMI, which is a BMI of 38. Okay, so if you guys have any questions regarding any type of procedure that you are interested in, please go ahead and ask away. We are answering any questions that you may have. So I'm just gonna put that in the comments just so that you guys go ahead and ask away. All right. Now, Dr. Mameniskis, what has been, for example, the happiest a patient has been with you?
Oh, there have been many. The one happiest, let me think of something offhand.
Maybe for like a wedding. Top three.
If you gave me a few minutes to prepare for this, I would have had a top three. I would have the top 10 probably.
Top 10, okay.
Many patients are stoked out of their minds and they're happy, and it's just my.
So probably for
to be continued. I will get together.
Okay, we'll do a separate video for that. But for weddings, have you done anything?
Yeah, for weddings, absolutely. Weddings, body contouring, mommy makeovers for weddings, and one of the procedures that gets a lot of just a wow factor are the rhinoplasties, because I do the procedure and it's a big structural change to the face, and the patient's nose is their personality, and when you take the splint off, it's really a great moment, and so that makes a big change right there.
Awesome. And for example, do you do ethnic rhinoplasties?
Yes, many, yeah.
Okay.
It's important to know, what the ethnic person wants in the rhinoplasty, what kind of change they want. It's important to keep somewhat within their ethnic backgrounds, whether it's Caucasian, Latin, Black, every race. So that's important. I do have experience with a lot of different people with that, and it is important to discuss it with the patient and get on the same page in terms of what exact change you're going to make and can make. And
have you ever had to fix a botched rhinoplasty?
Well, I don't like the botched word.
It's just something that they didn't technically want.
Well, yeah, but rhinoplasty, sometimes healing is very quick. Healing is very difficult too. Sometimes things don't heal quite right. There's scar tissue. There's a little bit of collapse of the cartilage. But yeah, I do secondary rhinoplasties. They're generally more difficult than the first time around because there's scar tissue and there's other factors to consider. But I do. If I can really make a change and improve, I'll do the secondary rhinoplasty. Okay.
And so typically for a rhinoplasty, would you need to remove the rib if you need that extra?
Yeah, occasionally. That's for people who really need building up of this bone, the dorsum, and that's probably the largest area of the case where I would need to use the rib. I can use the ear cartilage sometimes. Most patients don't need a cartilage graft. It can be done with their own tissue and taking some of their own nasal tissue and moving it around, but the rib graft is occasionally used.
And have you heard of, since we're on the topic of the face, have you heard of the buccal fat removal? Where they remove, is that something?
I do it, sure.
Oh.
I've definitely heard of it.
Guys, sorry, because I don't know. So all of this is new for me. So he probably knows it.
That procedure has kind of waxed and waned with popularity over the years, with ideas of beauty. But I think it's been back a little bit now, and people do want that look, a little that hollowed out look to give more of a chiseled cheekbone look. Yeah, that's a very easy procedure. It takes 20 minutes to a half hour, and it's a big change quickly.
Nice. And so that in terms. And alongside with the chin, you think it would make a drastic difference in the face without having to do the full facelift?
Yeah, chin. Maybe depends what they need. If they need chin augmentation, yeah, or maybe just a little neck lipo. Yeah, along with that, sure.
Okay, fantastic. All right, so guys, like I said, if you have any questions, please feel free to ask. Go ahead and ask away. In the meantime, we know that as we were talking about the beauty going back and forth in terms of the popularity, now it seems that people are more interested in skinny BBLs. What if you are too skinny for the skinny BBL?
Yeah, there is too skinny for the skinny BBL, unfortunately, and you have to have a little bit of fat, or else we really can't give you any shape. Skinny BBLs usually don't produce a large butt. It's just one proportion for the body, but you do have to have a little bit of fat. There is one option we have that works very well, which we don't use that often, but it does work. It's the buttock implant, and those do work for that group of patients who do not have enough fat or don't have any fat, but there are very specific healing recommendations, and there's a little more post-op care. Once you heal, you're good, but they have to take very precise care of things initially.
And then if they typically have the implant, how will their legs match typically after?
Yeah, you measure the patient ahead of time. It's not like the BBL. I mean, you know the size of the implant and where it's going to lay, so it can't be. Yeah,
okay.
No, it
Proportion.
can't be.
All right, fantastic. All right, guys, do we have any other questions for Dr. Mameniskis while we are in here? I had another question about the BBL because we definitely use the ultrasound, and that is super important. But what else would you recommend letting patients know to ease them in?
In terms of
feeling safe with not only the ultrasound being used now, but in general, what else has advanced, you think?
Well, I mean, certainly the amount of fat that we place, it's a reasonable amount of fat. We can't do any more than 4 liters of liposuction, which is a safe limit, which brings us down to about maybe 2,800 cc's, 3,000 cc's at the most we can put in, which is a very, very safe amount to put superficially under the skin. It's not going to be any issue being near the muscle. We use all the standard surgical precautions. We use the anti-clotting boots, and we give heparin, and sometimes we send patients on Lovenox if needed. Those are the important things to prevent clots. And just reinforcing the basics, early walking, early ambulation, plenty of fluids. Doing all those things, we usually give you a great result.
Fantastic. All right. Well, thank you so very much, Dr. Mameniskis. I'm looking forward to doing more videos, guys. So if you haven't already followed Dr. Mameniskis, you'll find him in our last couple videos. So thanks once again, and hopefully we see each other soon.